Will Thomas, respiratory therapist. I'm doing it for about 24 years, and I work in the Nampa, mainly ICU, but the Nampa St. Luke's here.
And a respiratory therapist through COVID.
Yes.
What has this year been like for you?
Challenging, definitely. I'd like to say we pride ourselves on being able to manage the most critical, the sickest of the sickest, and these are some tough cases. These are ones where we're having to work together with all modalities, physicians, OT, PT. What can we do to make our patients heal better, faster? Challenging.
Are there any particular patients, do you think, that you will particularly always kind of remember from this time?
Yeah. Unfortunately, it would be some of the younger ones that we may think that this is only for someone that's old, but in fact we may have a 40-year-old that has some other complications, maybe some kidney stuff or some diabetes, and you don't forget those because they were not expecting to come into the hospital to potentially die. Yeah.
How has the mood changed, do you think, in the hospital, knowing that you have no COVID patients today, which is amazing, and knowing that you guys were full just
Sure.
a couple months ago?
Yeah, it's a very nice relief. In fact, we actually just went to a kind of a grief session with this the other day. In fact, to kind of discuss some of those patients. It was really wonderful to kind of reflect a little bit and say, look where we're at now. Hug each other, positive. We weathered the storm, and we came out on top. So yeah.
Do you still kind of worry at all?
Oh yeah.
Yeah.
Oh yeah. You just don't know. Yeah. Yeah. We have no idea. Will there be another wave? If it is, one of the things I talked about at that grief session was the actual amount of deaths, which I hadn't heard an actual tally or a number for a month, and I was completely caught off guard that there was actually that many in a month, or especially those early months. And
What would you want people to know just about this time or what you've experienced?
are we good?
Yeah.
I would say, again, we're in talking about that grief session. One of the things that I thought about was the quality of our lives. That, in fact, one of the messages I try to teach to some of the people for smoking cessation and education is you could go at any time. You need to have that quality. Make sure you're doing everything that you can control. And what can you control? What can I not control? Genetics, you're born with who you are, but can I? So it is the strongest of the strongest, the one that survived this horrible virus. Well, it doesn't hurt to be that person that maybe doesn't smoke or is not maybe too overweight, things like that. It helps us help them better. So that was my message to anybody. I said, what can you do? What can we do? If we have to go through this again, what can you do to help control your own bodies? So yeah, it's super real. It's very real. It's very hard to deal with, especially if you have a family member that happens to get sick. Even though I work in the healthcare, I see it every day. When I myself got COVID, my wife as well, we immediately went, what does this mean for us? What's going to happen? What's day 2, day 3? Am I going to have trouble breathing? And it's a weird feeling to go, where am I going to go with this? So have I done everything to prepare myself? My vitamins, I've been running, am I doing everything possible? So, yeah. So yeah, it worked out well. Luckily, both my wife and I are pretty healthy. It's funny, I'm the asthma patient, and I had 2 really hard days, but then I was pretty good after that. I actually made sure to get moving. Bless my wife's heart, she just laid in bed and didn't move, and because of that, it was actually prolonged. So her experience was 3 weeks of misery. Mine was a couple of days with, unfortunately, a little bit of residual effects of feeling a dry, nasty cough. And I don't run like I used to. I was a good long runner, and I'm a short runner now for a little bit. So I think I'm still healing. I hope.
Anything else you'd like to add that you think is important?
Only to say that I super appreciate my fellow staff, my support from my boss. that allows us to get through this. That we probably couldn't have done it without them in a team approach. I'm very pro collective modalities. We all have to do this together, and definitely this was what could have been very negative was a quite positive experience going through this. So.
So it hasn't changed your outlook on the work that you do?
Oh, in fact, it's made it better. Makes me very glad to be working here, knowing that no matter what, we have the support of everybody, and we could handle anything, anything, any storm, any next virus, next bug. We got this. You coughing anything up? Nothing. Okay. Let me listen to you. See how you sound. You're probably going to go to a new bed. Probably going to